Good afternoon. My name is Dr. Lauren Bennett, and I'm from the Pickup Family Neuroscience Institute. Here today to discuss the early stages of dementia with you. We'll dive right in. Well, we will if the clicker works. There we go. All right, so when we think about cognitive health, we think about it in terms of a spectrum. Cognition, broadly defined, is the ability to think, learn, and recall or remember. When we think about that spectrum or continuum that I mentioned, there on one end is the optimal functioning in terms of your brain health and thinking broadly, all the way down to a severe disability, or what we think of in terms of the late stages of a dementia process. What we want to highlight today is that cognitive aging is normal, and there is some deterioration in our thinking and thought processes that's part of the normal aging distinguishing process. What I want to highlight today is when we outpace or outstep that normal aging process and step into an area where we should be concerned that those cognitive changes that you might be noticing in yourself or your loved ones, that they exceed what's normally expected as part of that normal aging process. So, as we age, it is normal for there to be subtle changes in aging. All of us slow down a bit in terms of our ability to recall information, but what we get concerned about is when it outpaces that normal aging. We'll talk through today what specifically that looks like. I also want to highlight there are many strengths associated with aging. So, as you all might be familiar or aware with, as we age, there's more wisdom, more life experience. There's more expertise that you've gathered from your time. Perhaps you notice that you're less emotionally reactive to those ups and downs that are part of the day-to-day living. And perhaps you notice that you're more calm overall and better able to make use of your strengths and weaknesses in terms of your cognitive faculties. There is a slowing, as I mentioned, in the speed of processing, sometimes key decision making, that may be normal as part of the aging process, meaning you're still able to do much of what you were once able to do, but it might take you a few beats longer to pull up the information or to make use of the information. And that can be a normal part of the aging process. What we think of next is, in terms of that spectrum or cognition, from that normal, optimal functioning down to the level of impairment that we were mentioning, is a process called mild cognitive impairment. You might know of it as MCI. And when we think about mild cognitive impairment, it's the stage that's in between cognitive decline of normal aging and on our way to a dementia process. So for some folks, they might develop mild cognitive impairment, which broadly speaking means impairments on objective testing, like neuropsychological or neurocognitive testing, but they're still able to function pretty well overall in their day-to-day life, meaning they're still able to manage their checkbook, their schedule, their routines, their medications, without much extra help. Perhaps a few extra reminders on your cell phone, perhaps a few extra post-it notes, perhaps you now need to use a pill keeper to help your medications stay organized, to recall if you've taken them or not, but you're still able to do many of the things you were once able to do, might just take a little extra external support. Now, I want to distinguish that from what we might see later in a dementia process. So for example, you might be having some difficulty with the cognitive processes of your day-to-day life, but it's not interfering with your day-to-day tasks, as we mentioned. There is, though, an increased risk for these folks who develop mild cognitive impairment to go on to develop an Alzheimer's or other type of dementia down the road. And that might be caused by external factors as well, this mild cognitive impairment that we're discussing. So for example, one thing that can contribute to mild cognitive impairment is, say, a deficiency in vitamin B12 or depression. So sometimes it can be challenging to tease apart what might be due to mood changes and what might be actually due to cognitive or organic changes in the brain related to neurodegeneration. That's where your primary care provider or a neurologist can be helpful in teasing apart those two different processes to see what might be treatable or recoverable and what might be a longer standing part of an early phase of a neurodegenerative disease. So when we think about cognitive impairment then, what do we mean? What we're talking about here is when there's cognitive processes that are impacted in day-to-day, everyday life, like the medication management, schedule management, or other daily activities, balancing your checkbook. And again, this is a wide range of functioning that's usually impacted by the time we get to a cognitive impairment phase. So So we've gone through perhaps a mild cognitive impairment, and now we're seeing a more broad cognitive impairment day to day. So you might notice that it affects not only your memory, but also your processing speed, for example, or perhaps your language functioning, meaning you might have more difficulty coming up with the right word in conversation. Perhaps the wrong word might occasionally slip out, like you mean to say telephone, but you say spatula instead. So these other cognitive processes might also be implicated in this process. You might notice these changes across multiple domains of cognitive functioning. Usually, these cognitive impairments, these types of changes in the brain, occur as a process that's related to, say, Alzheimer's disease, a stroke, or perhaps a traumatic brain injury. When we think about dementia then on our continuum, dementia is a decline in mental ability that's severe enough to impact or interfere with day-to-day life. So this is when someone might need another person to assist with many of these tasks in terms of their day-to-day functioning, again with medications, schedule management, or financial management. And this is not a norm for aging, right? So this is not what we would expect. I often hear from patients or folks alike that they expect that that might be part of the aging process. Say, I'm not really able to manage my finances anymore, but that's because I'm 85. And I want to pause here and really highlight that we do not expect that just because someone is aging, that they would lose their ability to perform in these areas. That's really beyond what we would expect, and it is something that we want to make sure that you're getting proper and adequate medical treatment for. So just because you age does not mean that we would expect to see this level of decline or impairment in your cognitive functioning. And when we get to a dementia process, we're often seeing that it's progressive, meaning we would expect that the individual would have increasing difficulties across time. So most of our dementia processes are slow and insidious, meaning they're very subtle at the beginning, but upon looking back, you might say, gosh, looking back about 5 years ago, there were some very early changes. They needed more help remembering when their weekly events were, that book club that they go to, or Bible study. They needed to be reminded more frequently of that information. And I want to highlight that dementia is an umbrella term. So we'll talk through what that means here, but I want to start with the progression first. So when we think again about the spectrum, we start with normal or totally intact cognitive functioning. Oftentimes we move into the mild cognitive impairment, meaning it does not yet interfere with day-to-day functioning, other than that the person might need some additional supports. We might then move or progress into a mild dementia process, meaning that we're starting to see that there's slight changes in their ability to function independently in those instrumental activities of daily living, finances, schedule, medication management. Then we move into perhaps a moderate dementia, where the individual needs far more support in order to get through their day-to-day life. You might see changes in their ability to cook. They might forget that the stove is on, for example, or heat something in the microwave and never return to fetch it. They might need more support in those kind of more basic functions of day-to-day life. And then in the severe dementia phase, oftentimes folks will need a lot of support with their basic instrumental activities of daily living, meaning things like hygiene. They might get in the shower, for example, and forget to wash the shampoo out. So they might need more hands-on guidance in terms of how to get through day-to-day activities. And then when we think about the causes of dementia, as I mentioned, dementia can be caused by a number of different etiologies, which is a fancy word for causes. But broadly speaking, dementia is the result of damage to brain cells from either disease or trauma. So there can be contributions from your genetics and your family history. So someone might have a higher risk for developing a dementia process as the result of their genetic loading. For some of you may have heard of something called an ApoE allele. And what that is that there is a loading on our 19th chromosome that it keys into your risk or correlates with your risk of developing dementia of the Alzheimer's variety, for example. So we see that folks who have a 4 allele or 2 4 alleles, there are 2 positions on this chromosome for alleles, and if someone has either 1 or 2 of those 4 alleles, they have a higher likelihood of developing Alzheimer's disease. Conversely, if someone has a 2 allele, you actually have a lower risk, or it seems to be a protective factor for developing Alzheimer's disease. So we're learning along with the science to support this area about those genetic risk factors and loadings. But the basic takeaway here is that if you have a family history meaning you have a relative in your family or relatives in your family who have experienced any number of neurodegenerative diseases, such as Alzheimer's, vascular dementia, Parkinson's disease-related dementia, Huntington's disease dementia, any of those neurodegenerative diseases, you yourself might be at a higher likelihood for developing a dementia in your future. There's also a contribution from lifestyle factors. So very broadly speaking, about half of our risk is genetic and about half of our risk is lifestyle-based. And when we look at the research on lifestyle preventative factors, there's 5 key ones with a 6th kind of minor one that I want to highlight for you here. So the first is cognitive activity, physical activity, social activity, managing mood, good sleep, and good diet, right? So those are the 6, broadly speaking, kind of pillars that we can help to support our overall functioning. What I want to encourage all of you to do today is to kind of take stock in those areas in terms of how you might optimize your functioning. Again, physical health, cognitive health, social activity, good sleep, good diet, and managing mood or stress symptoms. What we know is that actually for folks that experience symptoms of depression or anxiety in midlife, that can actually be one of the risk factors for later developing a dementia process, for example. So it's one area where you really want to be proactive about managing all of the potential risk factors, particularly if you do have any genetic predisposition for developing a dementia process. There's also your medical history. So broadly speaking, things that are good for your heart are also quite good for your brain. So as we touched on, good diet, good exercise, taking all your medications as prescribed, and broadly managing any co-occurring chronic medical conditions, things like diabetes, high blood pressure, high cholesterol. Over time, all of those conditions can lower the threshold for what it might take for you to develop an Alzheimer's type dementia or a vascular dementia. So by managing your chronic health conditions, you're giving your brain every possible advantage in terms of optimizing its functioning for as long as possible, or healthy aging, as it were. And here you can see what I was mentioning earlier. So when we think about dementia, dementia, broadly speaking, is an umbrella term. Dementia means impairment on objective neurocognitive testing, like neuropsychological examination, and changes in your ability to do day-to-day instrumental tasks of living. Again, those are things like managing your checkbook, doing your taxes, coordinating your calendar, all of those different pieces together. So dementia is the umbrella term, again, just cognitive impairment objectively and subjectively. And then the causes of a dementia process are all of the raindrops that you'll see down below. So first and most infamously is Alzheimer's disease. And depending on the research that you read, our most up-to-date estimate is that about 60 to 80% of all dementias are caused by Alzheimer's, which is why you've probably heard that word before. So Alzheimer's is a type of dementia, but it's not the only type of dementia. And just because somebody has Alzheimer's etiology or a cause in their brain, they might actually still be in the mild cognitive impairment range, meaning pre-dementia, and they may or may not go on to progress. But generally, we think of Alzheimer's as a progressive disease, so we want to be as proactive as possible about managing the disease process. We also know that Lewy body dementia and vascular dementia are quite common. First, I'll speak about vascular dementia. So when you think about the blood vessels in your brain, it's a little bit like a tree. You have the arteries coming up through your neck, and then there's tiny little blood vessels that go out into both hemispheres of your brain. And over time, the blood is flowing up to the brain, and much like you might be familiar with in terms of your heart, there can be plaques that build up on the walls of those blood vessels that make it harder and harder for the blood to get where it needs to go. Over time, without getting adequate amounts of blood, the tissue around those tiny blood vessels at the ends of those fingers or the ends of your blood vessels in your brain don't get the nutrients and oxygen they need for the tissue in your brain to function optimally. So you can see changes in the cells that are around those blood flow areas. And what we call that over time is a vascular dementia. So you see very tiny, small vessel ischemic changes on imaging, like a picture of your brain or an MRI, that can show up as having damage to those tissues that impede some of your cognitive functioning. You might have also heard, of course, of a stroke. A stroke can cause acute dementia as well, meaning that there might be a massive vascular event, so still under the heading of a vascular dementia, that causes impairment or damage to a specific part of the brain where there may have been a bleed or a hemorrhage of some sort. Then, you may have also heard of Lewy body dementia. So Lewy body dementia is a type of dementia that can cause both movement symptoms, meaning rigidity, difficulty with your walk, or what we call gait. It might also cause cognitive symptoms, meaning changes in your ability to think or process, slowing down overall in your processing speed. And oftentimes we see in folks with a Lewy body presentation that they might struggle with things like hallucinations or strange or unusual beliefs called delusions, for example. That's also quite more prevalent than we initially thought, and Lewy body dementia is thought to be between 5 and 10% of the overall dementia processes that we see day to day. There are a few other types of dementia, broadly speaking, one of which is called frontotemporal dementia. And then the other ones that I just want to touch on are Parkinson's disease dementia and Huntington's disease dementia. Not all folks with Parkinson's disease who have the physical or movement symptoms go on to develop a cognitive piece of that disease process. So they don't all develop Parkinson's disease dementia, but about 30 to 50% of folks with a Parkinson's disease will go on to develop cognitive changes, usually 8 or so years after the development of movement symptoms. So it's usually much later in the disease process. And as I mentioned, there are hundreds of causes of dementia broadly. I've just highlighted the most common here. You'll see a few others that are listed that I want to make you aware that dementia, or that change in both your day-to-day functioning and your performance on objective testing, can be caused by a number of other causes. A few that I want to highlight in our time together are substance-induced dementia, which means perhaps changes related to either alcohol use or a recreational substance or prescription medications that are abused. So we can see that there can be changes in your thinking and memory that lead to a dementia-level impairment. Sometimes those might be corrected, or they might see progress or improvement after the individual has gotten successful treatment for their substance abuse addiction issue. There also can be changes related to other demyelinating disorders, the most infamous of which is multiple sclerosis, for example. So there are many reasons, many causes of dementia. And the first step, if you feel like you have any changes in your thinking or memory, are to talk to your primary care provider, or if you're already working with a neurologist, to go to your neurologist to discuss that and have a full workup done so they can rule out what might be treatable and what might be a more lasting neurodegenerative disease that might need different treatment courses or options. So moving back to our spectrum or our timeline in terms of what we think of when we think about mild cognitive impairment moving into a dementia process, about 7.5 of folks who have mild cognitive impairment will move on to or develop a dementia process within 1 year of their mild cognitive impairment diagnosis. So it's still relatively low. Most folks are able to manage the symptoms that are contributing to their mild cognitive impairment relatively successfully to either plateau their changes in their cognitive functioning and maintain their performance in that mild cognitive impairment range, or they might be able to actually reverse the issues that cause that mild cognitive impairment in the case of perhaps a sleep disorder, for example, not getting good quality or good quantity sleep, or a vitamin deficiency, or perhaps even mood difficulties. They might get successfully treated with either a talk therapy regimen and or an antidepressant, for example, and they might see improvement and resolution of the mild cognitive impairment. So I would encourage you again, if you have any concerns about your thinking or memory, to start with a full workup, because sometimes these issues can be fully treatable. Oftentimes they are at least in part treatable. All right, so let's talk through the early signs of cognitive decline. What is it that you should be watching out for in your day-to-day life? So when we think about the first one, most commonly, of course, is our memory. As we mentioned, when we age, it is very normal for you to walk into a room and suddenly look around and have no idea what in the world you're doing there, right? Has anyone had that experience before? I know I certainly have, of course. So I want to highlight here that some of these changes in our memory are absolutely part of the normal aging process. And for many of you that might be parents, perhaps many decades ago or even more recently if you've been taking care of grandkids, You might remember in your sleep-deprived days of having a newborn or a young child around that you also had that phenomenon of walking into a room and having absolutely no idea what you're doing there. So my point in sharing that is that sometimes these experiences, these changes in our cognitive functioning, can be due to these other factors, like sleep deprivation, like having a million things on your plate or on your list of things to do. So thinking through what's caused by an organic neurodegenerative process, and then what might be part of the normal aging process, and then even beyond that, what might be part of normal aging or a situational factor like a sleep deprivation, for example. If you find that you're having more difficulties with your memory, so for example, you're forgetting your medication pretty routinely. Let's say you take 2 doses, one in the morning and one in the night, and you're often going to your pill keeper and you're realizing when you go for your evening medications that you've rarely remembered to take your morning ones, or that it's happening several times a week. That would certainly be a concern for me about wanting then to reach out to your primary care provider or a neurologist that you're working with to have a discussion about what might be necessary in order to evaluate your memory further. As I mentioned earlier, some of the other changes we often expect are in language functioning. So most commonly that I hear is word finding difficulty. And this can be coming up with the name of that actress who was in that one movie that one time that you saw 30 years ago. I'm not as concerned about that. But if you're having difficulty recalling the name of the gentleman that you play golf with every Tuesday for the past 20 years, then I am more concerned. Similarly, if you're having difficulty coming up with the name of a family member or someone you know well, that would also be a cause for concern. Or if you're seeing any kind of pattern, meaning that this is happening routinely or more frequently than you once maybe experienced. Oftentimes, folks are also experiencing misnaming of items. Like we said, they might come up with the wrong word in conversation, substituting a more generic word, saying animal when they really mean dog, for example, or the wrong word entirely might come out, as is the case in our telephone, but you mean to say spatula example. So thinking through how commonly this is happening, how frequently this is happening, and to what level is it happening? Is it happening when you're distracted by the television being on, you're trying to get dinner on the table, and someone's on the phone with you at the same time? Or is it happening when it's quiet environment, you're really focused on a task, and there's not too much else demanding your attention? Next up, I want to touch on processing speed. So processing speed is how quickly you can take in information, make use of that information in a meaningful way by interacting with your environment. So, for example, how quickly it takes you to respond in conversation, or take in a point of information about a task that you're supposed to do, process that instruction, and then in turn turn around and effectively do that instruction. It is normal as part of the aging process to take a bit longer or a beat longer to process information in your day-to-day life. But if you're noticing that you're very slowed down, meaning it's taking you double the amount of time to do a task that it would have previously taken you, if you're noticing that you're routinely struggling, that's when we want to have a conversation about that processing speed change, again, with your primary care provider or a neurologist. And next up is attention. So your attention is how able you are to focus on any task in front of you. The way that I will often ask folks about this area of functioning is if they're having difficulty tracking a conversation. Now, at the risk of being humorous, I will often hear from my male patients that they're having particular difficulty tracking a conversations, but that really only extends to their wife. Sorry, ladies, it's true. I hear it from my husband as well, right? So with that in mind, I always try to ask for multiple environments. If someone is having difficulty tracking conversations with their wife, but we're not seeing any of that difficulty, perhaps if they're still working in their work relationships, or if they're still consulting or having calls with, say, friends, and they're still able to track those calls, or any other setting where we might expect it, we really want to look at the context and see if it's presenting in one situation or if it's presenting in multiple situations as well. I will also ask if someone is having more difficulty tracking the plot line of movies or television shows they might be watching. Now, admittedly, with the pandemic, I know a few of us are watching a bit more television than we previously did. Anyone out there relate to that? I'm sure, right? So, to that end, if you are on your 9th Netflix series of the week, no judgment, absolutely, But it might be a bit more challenging to track that plot line of that 8th or 9th programming series than if you're just watching one show at a time or one show over a measure of many weeks, for example. So always trying to tease apart what might be due to the situation that you're in or the burden on your brain, and what might be a true change from what you would have been able to do, say, 5 or 10 years ago. And the next area is executive functioning. So executive functions are higher order tasks that live in our frontal lobe, so the very front part of our brain here. So these are things like planning, organizing, sequencing, and this, for example, might be if you were hosting a dinner party and you were cooking and trying to get all of the plates out onto the serving buffet at the same time. So you've got multiple dishes going and you're trying to keep everything warm and coordinate the timing to get it all to come together. Another good example might be, remember when we used to travel? Does anyone remember those excursions that we used to take? Yep. So if you were trying to book a trip for a very hopeful 2022, let's say, would you be able to find and research the location in your destination, book the flights, book a hotel, research and book a few excursions? Could you coordinate all the pieces if you needed to take a train trip from the first city to the second city? Would you be able to pack your bag accordingly, making sure you got all of the outfits that you would need for these set excursions? If that's an area where you might have more difficulty than you originally had, say 5 or 10 years ago, then that would be a nice conversation starter for your primary care provider and or a neurologist. So when should we be concerned, right? There's a number, like we said, of different aspects or angles that you're watching for, and there is this spectrum or this continuum. So let's go through 10 signs that I want you to watch for in terms of your day-to-day life. If you are experiencing memory loss that is disrupting your day-to-day life, meaning things like those extra reminders on your smartphone or your Post-it notes or that Alexa reminder from your smart home device to take out the trash cans, those are routinely not working, then I want you to initiate a conversation with your primary care provider and or get an assessment. This might also look like word finding difficulties, because that's a part of our memory as well. Might look like misplacing objects more frequently. So if you come in and you tell me that you've misplaced your wallet or your purse several times within the past year, and that's never been who you were characterologically, I might be a little more concerned. However, if you tell me you've always been a bit of an absent-minded professor type, and you've frequently lost your wallet across the span of your life, it may be less concerning or less out of character for you. Similarly, if you're having difficulty recalling names of people you know well, recent conversations. If you find that your loved ones, and not just your wife, are saying, remember, we talked about this, we're leaving tomorrow at noon. If you're hearing that several times from different people, then certainly I do want you to have a conversation, initiate a conversation with your primary care provider. And same thing about reading. If you're finding that you're having difficulty recalling the plot line of a book that you're reading, or even the content of a magazine or newspaper article that you read, that would also be an area where I would get concerned and want you to raise that concern with your primary care provider. If you're noticing, for number 2, changes in your planning or problem-solving ability. So to use our dinner party example, if you're having more difficulty coordinating multiple dishes at once, if you're having more difficulty managing your stock portfolio and tracking all the moving pieces, perhaps you missed out on that GameStop surge last week. That's not like you. If you missed out on any of these changes in terms of your ability to plan and sequence and organize, that would also be an area where I want you to initiate a conversation with one of your treating providers. If you're having any difficulty completing familiar tasks, so this might mean getting lost on the way to your bank that you've gone to for 20 years. This might mean having difficulty managing your checkbook when you've managed the checkbook for 40 years. Anything that you've routinely done that you're now noticing a change in your ability to do, meaning it's taking you much longer to do it, and or you're no longer able to do it, you're making more errors, having more difficulty, that would also be a starting point for a conversation. If you're experiencing any confusion about time or place, not knowing when you are or where you are, that would also be a conversation to have. If you're having any difficulty understanding visual images and spatial relationships, meaning all of a sudden you're knocking that front fender on the garage when you're pulling in, you're reaching for an object and knocking it over, you're missing the doorknob when you reach out for it routinely, you're clipping your shoulder or your arm on the doorway more frequently, or perhaps having difficulty making sense of graphs that you might see in the newspaper or a news article or on a news reported programming. If you're having more difficulty making sense of visual images in front of you, would also want you to mention that to your primary care provider or neurologist. And continuing on with our 10 signs to watch for, if you are developing a new problem with words in terms of your speaking or your writing, I would also want you to have a conversation. So that might be more difficulty coming up with the right word in conversation. If you're having difficulty articulating or actually getting the words out, meaning you might fumble your words more often, might take you more effort, or you might be stuttering or halting in your speech. If you're having difficulty getting your thoughts out into the world, meaning actually producing the sounds and making your thoughts into communication patterns, would also want you to mention that to your treating providers. If you're misplacing items more frequently and losing your ability to retrace your steps, right? So we have all put the milk in the cupboard before, right? No, just me? Maybe just me. But if you're no longer able to retrace your steps and go, gosh, okay, what was I doing in the kitchen? Where did I go? Okay, then I got the cereal out, and you open the cupboard and you see it there. If you're not able to retrace your steps with that same efficiency, that would also be when I was getting concerned. As we mentioned, if it's happening more regularly, that would also be a conversation to have. If you're noticing that this is now happening routinely, for example. If you are having any difficulty with your judgment, so the joke I will often make with folks is buying a boat when you have never been sailing or you don't swim, making inappropriate comments to strangers or family members even, anything that seems truly out of character for you. Any kind of compulsory behavior, so if you get very fixated on something, develop a gambling addiction, gosh forbid, any of those kinds of patterns of behavior, we also want to have a conversation about that very early on. And then if you notice any withdrawal from your work or social activities, meaning that you're more apathetic or not as motivated to engage with folks that you care about, you're not as likely perhaps to be as chatty or conversational, that might be a normal change or fatigue-related change. But if you're noticing that you're not as inclined to reach out to your children who you've been very close with and always enjoyed an intimate relationship with, that would be an area where I could be getting more concerned. If you're not as motivated to engage in hobbies or tasks that you once enjoyed, like golfing, for example, because of the social interaction, I would definitely want you to follow up with a conversation with your primary care provider. And similarly, any changes in mood or personality. So anything that seems like a big shift from how you were, say, the last year or even 5 years ago. If your family is noticing a significant change in your temper, maybe you're much more irritable, much shorter fuse, much more reactive, for example, or significant changes in your personality, meaning no longer enjoying engaging with loved ones, no longer enjoying hobbies, that would certainly also be a point to initiate conversation with your primary care provider. All right, and now I want to move into some of the risk factors for the various types of dementia that we've discussed thus far. So the most prevalent, the highest in terms of our risk for dementia of the Alzheimer's variety is in fact our age. So after the age of 65, the risk for Alzheimer's disease doubles every 5 years, making it so folks that are 85 years or older, there's about 1/3 of the 85 plus population that have Alzheimer's at any given point in time. So very connected to an aging brain, especially as we enter that 8th and 9th decade of life. As we mentioned, of course, another risk factor is also family genetics and family history. So if you have a first-degree relative or second-degree relative who had any type of these disease processes, most namely Alzheimer's, that can be a risk factor. The lifestyle factors, as we highlighted. And then there also is a correlation between race and ethnicity, such that Latinos and African American individuals are more likely to develop Alzheimer's than their Caucasian counterparts. And we don't quite understand the full mechanism of that yet, but it's something about the DNA risk factor on our genes in terms of the loading for that. When we're talking about vascular changes, so those are the changes in the blood vessels throughout the brain, either due to small incremental changes across time or a stroke process, or both. Age is also a risk factor in our vascular dementia, but there also are the cerebrovascular risk factors that you might expect to be related with heart disease, are also highly correlated to your risk for vascular dementia development, such as high cholesterol, high blood pressure, diabetes, any kind of smoking history, obesity, and a sedentary lifestyle. So when we think about this broadly, the worst thing you can do for your brain is to become a couch potato, We want you physically active, socially active, and cognitively active throughout your day. I want you tuckered out with a busy day and an active calendar, so you're going to sleep well at night as well. That will really help support optimal brain functioning and graceful brain health aging. So how do we monitor for cognitive changes across time? Well, one option that we have here through Hoag is what's called the Orange County Vital Brain Program. And that is a brief check-in, about 45 minutes, that we invite folks to do once a year to check in on all of these various aspects of cognitive functioning. And they complete a brief verbal memory measure to track for any change, progression, or differences in how they're functioning in terms of their day-to-day health. The other option, of course, is starting with your primary care provider. So as I mentioned, it can be super overwhelming to monitor for cognitive changes, but if you notice something subtle, I would encourage you to reach out to your primary care provider. Don't hesitate to make an appointment to discuss your cognitive health. It can be particularly helpful to jot down some notes about the changes that you may have noticed in your day-to-day functioning, so you can bring in those specifics to your provider. So if you mention things like word finding difficulty or the types of changes you've had with your memory, perhaps you're having difficulty recalling recent events, recent conversations, those kinds of specifics can help your primary care provider get you to the right next level of care in terms of doing a thorough assessment and making sure that they're evaluating for any possible causes or contributions to those cognitive changes you've noticed. I would also invite you all to ask your loved ones, your close friends, your close family members, to keep an eye on you, right? So the best and first line is those folks who know you well. They're going to be able to pick up on any subtle changes. And oftentimes folks will wait until the changes get more pronounced or more noticeable in day-to-day life to mention it to their treating providers. But I really want to encourage you to be proactive, especially if you have any family history, like we were saying, or any of these comorbid health conditions that might increase your risk. So by being proactive and asking your loved ones to keep an eye out, you'll really see if there's any early hints or any subtle changes in terms of any of these areas of cognitive functioning that we want to watch out for. And I just want to draw your attention, as I mentioned, first up was our cognitive brain health program here at Hoag. And I've included the website there. If you're interested, you can get more information about that brief screening on the website there. And then what should you do if you notice any cognitive changes? Well, as mentioned, going to your primary care provider. Again, the goal here is to rule out all of the things that are most treatable, and then of course get you on treatments that can be preventative in terms of tracking the progression of any of these issues. So we want to rule out any acute medical causes like an infection, a vitamin imbalance, or hormonal imbalance is listed there. Also, sometimes medications that you're on might have a negative effect on your cognition. So it might be as simple as talking to your doctor about the medications that you're on to see if any of them have a higher risk of adverse or negative cognitive side effects, right? The one that I often hear the most is that folks who are taking antihistamines, like Benadryl, it's actually a really negative correlation with our cognitive functioning. So that might be a starting point for you to have a conversation, but the medications that we know are linked to a higher risk of developing dementia processes or can have a negative impact on our cognition overall are what's called anticholinergic medications. It's a whole classification of medications that can have a negative effect. And it might be a starting point for you to have a conversation with your provider just to see if you're on any of those medications currently and if there might be an appropriate substitute. Also, I often encourage folks to go for a hearing assessment, right? So sometimes it can be tough to tease apart what's not hearing your wife, gentlemen, versus what's not remembering what she said. An easy way to figure that out is to get a full hearing assessment to see if there is any difficulty with your hearing that might be contributing to some of those what we call memory difficulties that might actually be hearing related. And then of course we always want to consider contributions from poor sleep. So we know, and we are learning from our research in the sleep arena right now, that sleep is more imperative than we have ever fully understood until this date. What we know is that if you're not getting good quality and good quantity sleep, it's really difficult for your brain to function optimally. So specifically, if you are finding that you're waking up routinely throughout the night, you're getting what we call fragmented sleep. When you're getting fragmented sleep, your body is not able to go through all of the sleep phases that we associate with the best possible time to clean out some of those brain toxins. So specifically in stage 3 and 4 of sleep, there is a process that occurs in our brain within our neurons or our brain cells where they get cleansed of some of the toxins that naturally build up over time. If you're getting fragmented sleep, you're not getting that good quality sleep that's allowing you to adequately cycle through all the sleep phases and get that benefit of the sleep that we see across time from that cleansing effect. So I really want to encourage you to monitor for poor sleep and to be proactive about talking with your providers about any sleep changes that you may have noticed. And then, of course, as is often the case for many of folks, even more so now with the ongoing pandemic, monitoring for any mood difficulties or high levels of stress. It has been a very challenging 2020, and as we move into 2021, there's still a lot of difficulties and barriers and obstacles to overcome. Associated with that, many folks have had significant changes in their lifestyle and in their mood functioning because they're not able to engage in the routines, the tasks, the activities that they once enjoyed, or certainly not as readily able to engage in those things. So with that in mind, I want to encourage you to have an honest conversation with your primary care provider about any mood changes you might experience. As I mentioned, depression and anxiety can actually be risk factors for the development or progression of a neurocognitive disease like an Alzheimer's etiology or a vascular dementia. So managing those mood symptoms is not only beneficial in terms of your overall day-to-day emotional functioning, but it's really imperative and it's part of the brain health puzzle as well. So if you are so interested or if you'd like to be proactive in your care, your next steps might include a brief assessment with your primary care provider or with our Orange County Vital Brain program if you're interested. And then from there, your provider might give you a referral to a specialized clinician like a neurologist, for example, who might be able to monitor those areas of concern. Thanks. All right, we've got a question coming in. Yes, one of my favorites. Okay, so the question is, can taking alpha-lipoic acid help prevent dementia? And I will defer you, of course, to your primary care provider to have a conversation about any medications and supplements because you always want to disclose to your provider all of the medications and supplements you're on because of the potential for interaction. But what we know is that generally speaking, if it sounds too good to be true, it probably is. So your primary care provider will often do a full workup on your blood work, and if they notice any areas that are deficient, any vitamins or hormonal deficiencies, they will often then, of course, refer you to the appropriate specialist to get those managed. But outside of that, we don't see much benefit from taking some of these preventative medications or supplements. So there are some research trials ongoing, and again, I would encourage you to talk to your primary care provider about the specific supplement that you're interested in. But generally speaking, what we know from the research is that these lifestyle factors, staying cognitively active, physically active, socially active, good sleep, good diet, and managing mood symptoms are our best case scenario in terms of managing and optimizing our brain health overall. All right, so what can we do to reduce our risks? Which that was a perfect lead in with that question, so thank you. As mentioned, these are the areas of prevention that I truly want you to focus on: the sleep, diet, exercise, cognitive engagement, which means finding cognitively taxing or engaging activities. That might be a puzzle, for example, might be crosswords, might be a discussion group that you're doing on Zoom, might be a Bible study, for example, might also be taking a emeritus course through any of our local community colleges or an online institution. Looking for things that are going to give you cognitive engagement, something enjoyable, though, that you'll look forward to, not always just work, but doing those tasks that you enjoy that are still cognitively engaging, that have an element of problem solving or novel thinking will be really helpful for cognitive health. Also, social engagement. So this one's a bit challenging to do in our current climate, but with that in mind, very important to stay socially connected through Zoom calls, phone calls, socially distanced outings, but really staying connected to your community. We see that that has a huge benefit in terms of our overall emotional health and our cognitive health as well. And then, of course, managing any mood symptoms you might be having, like stress or anxiety, and then, of course, thinking about any depressive symptoms as well. And I'll pause here on this slide. This is our Orange County Vital Brain, just to give you one more opportunity if you're interested to jot down the information related to our program here. That's the website listed on there, as well as the phone number where you can call to schedule if interested. And I also wanted to share a few resources in the time we have left. So the first one that I wanted to highlight is something called the Southern California Council on Aging. And they're a wonderful nonprofit, along with the Orange County Alzheimer's Association, that's really meant to support changes in thinking and memory broadly and help support our aging older adult community. So they have resources on everything from how to get your advanced directives together, which health insurance plan might be appropriate for you, transportation services if you need them, respite care if you're a caregiver for someone with a dementia process. So I would invite you to visit their website or call their introductory hotline there and ask about any resources you might need in our community. They're really wonderful organizations and such great starting places for any questions you might have. All right, and I'll pause here to see if there's any other questions. Doesn't look like it. Well, thank you all so much for joining me today. It was an honor and a privilege to be with you, and I encourage you all to take some inventory of what you can do to best support your brain health, and we look forward to hopefully treating you here at Hoag. Thanks so much.